Hello everyone, I'm Chen-Szu and I was an ER nurse. I'm an ER nurse which is come from Taiwan. Today I'm gonna share my topics the management of the hospital emergency team in patient safety, which is including COVID-19 and non-COVID-19 patients. From beginning, I will start to briefly introduce myself. As I mentioned before, I work in ER, which is in the medical center, is in the southern Taiwan. The name is called the National Chen-Szu University Medical Hospital since 2014. And because my master degree, my specialty is in disaster nursing, so I also work in the emergency medical operations center, which is under the Ministry of Health and Welfare. So I learned it very much. I collect the data about the disasters, and so I also do the report to the government. And I have some community involvement in which is in we have happens in a big earthquake in Tainan, which is my hometown. We call it happens in February 6th, the Tainan big earthquake, which I go there for the volunteers. And when I was students, I also be the youth ambassador in Solomon Island, and also I be the medical volunteers in Malawi, which is in Africa. Okay, just briefly my self introductions. So this is the outline I want to talk about today. So the first one is I want to share the major events of COVID-19 in Taiwan. And second, the curious policy for why our government combating the COVID-19. The final, I will share my experience in the patient safety management in my hospital. So as you can see the data, the trend of the COVID-19 total cases is still rising in the global, but in Taiwan, the confined cases are under like 1,000 people. Let me tell you the numbers more clearly. About 1 billion people are confirmed COVID-19 of the confirmed cases. And also there have been 2.4 million deaths. So their case fatality rates are 2.2%. You can see in Taiwan, the confirmed cases are 937. They only got 9 deaths. The case fatality rate are 0.9. It's almost 1%. So you can see the gap. Like we only got less cases and less deaths. So people can coordinate with the government. Maybe it's the reason that helps us or help the government to control the COVID-19 situation. So I think most of you may not so familiar with the things or the events that happens in Taiwan. So I just pick up several major and important events to let you know. Like the first of all, we know that it happens. We call the CDC found that a typical pneumonia in Wuhan was in 2019 in December 31st. So our government, one of my government's the members, they found out on the online resource. They found maybe they have some atypical pneumonia cases. They find the information, and then they try to communicate or connect the WHO about the process or some progress of the pneumonia. So in 2020, the January 5th, they formulate the definition of the coronavirus cases and reporting and handling the procedures. So in the front, Taiwan established the Central Epidemic Command Center for this severe pneumonia. And then another day, we found the first COVID-19 cases in Taiwan was confirmed, which is in imported cases. And then, after we found out the first 8 cases in Taiwan, we started to think about maybe we have to keep our manpowers in Taiwan. We have to make sure that our manpowers is efficient. So our government start to restrict the medical personnel or the social workers to travel overseas. And then in 2020, in February 2029, we found that we happened the first facility cluster in the hospital, or no, in the nursing care facility. So we start to request the hospitals to carry out to cleansing or to disinfections and infection control. Start to do the more management in the infection control. And then we start to make some decisions about we made sure to forbidden or restrict the visitors, which is not which is no medical needs. They just to like the families or the visitors they come from the community. So we have to forbidden or to restrict them to come to a hospital to control. There's not a lot of non-medical work or non-medical to let you get the therapies in the hospital. And actually, in this year, in the January, the Central Epidemic Command Center they found there's 2 indigenous cases in Taiwan. So that was shocked because it's during a long time we don't have the indigenous cases, but it happens right now. So our government just start to investigate those people's where they worked, where they have been, and who they have touched. So we just calculate the numbers and do the investigation. So we start to do the prevention, like to control those people. They have to stay at home or they have to test for PCR. They do it again and again. And right now is almost controlled for the indigenous cases. So our government actually this time do a lot of things, like for the crucial policies for combating the COVID-19. So there's many ways. There are different ways that the government to spread the information to the public. So as you can see, the first, our Central Epidemic Command Center, they hold a press conference every day, so they can tell the public the rules or the update data. They hold the press conference every day to update the confirmed cases, and the route that the confirmed cases have been to. And still, like telepublics that the newest situations in Taiwan. So they also showed some notice or the health education on the videos, like on the YouTube or on the TV commercial. So everyone gets the knowledge or gets the notice about the COVID-19, like how to wash their hands or how to wear a mask or kind of this. And also we will post the poster or leaflet for the local health bureau. They just give us the poster here, not just in Mandarin or in English. They also translate in Indonesian or also in Vietnamese. So it will translate to different languages, which is come from like maybe different countries. They will come to Taiwan, so they want to get more people to get the information more clearly, so they can control the situation. And also the line message, they can we can add the Ministry of the Ministry of Health and Welfare's line, so we can get the most newest information in the line, and immediately they can send it all the message there, so everyone can get the message immediately, and like the important message they can get. And also our policy, our government to make a policy to ask people to wearing mask in this area, in these 8 area. So one is the medical facilities, and another one is school, and for children's or other different kind of school, or an entertainment like the KTV or do the bar or kind of this or all the entertainment area. And also we have some religions, they can go to the temple, so it's inside, so we have to wear mask. And also we the public take the public transportation. Also they go to the store, convenience store, department store, and the theater, gyms, or museum. And also they do the business to the government. They also is inside the building, so they have to wear the mask. So this is the policy to ask the people to wear a mask. And then the Ministry of Welfare will set up the 3 group of the persons at the risk of infections. So the first one is the home isolation, which the person had contact with confirmed cases, so they cannot go outside within 14 days. So after 14 days, they have to do the 7 days self-health management. I'll talk about the self-health management later. And also, if they have some symptoms, like to need to go to the hospital, so they have to call the Ministry of Health or some kind of the special phone numbers, so they can decide or they can assign those the symptomatic people to go to the decide or assigned hospital. The second group will be the home quarantine, and this was if they the definition of the quarantine will be the people with the travel history. So only travel history, they also cannot go outside for 14 days. They have to stay at home. And after the quarantine period ends, they have to do an additional 7 days about self-health management. And the third group was the self-health management. It if they are they have some URI sign, or they have some suspect they have the pneumonia or infiltration kind of this. They have URI the symbol the symptoms. They have reported by the PCR. The COVID-19 the PCR is negative, so they have to do the self health management for 14 days, but they can go outside, but they cannot to take the public transportation, and then they can not cluster with the friends and the family. So that's the big pictures of the three groups that we have followed based on the Central Epidemic Command Center. So not only for the public, but we also to think about our medical care capacities. So the two things: one is the monitor medical care capacity. Another is we think about we have sufficient the medical care manpower. So actually we will set up a screen station, like a fever screen station, or some epidemic prevention clinic for COVID-19. We set up special stations for those people they want to test, or they have some sign. We want to separate, like some of the people they come from they only have the TOCC, they only have the travel history, but they don't have some URI sign or not fever. So they might, but they have to do maybe in the previous time they have to test. So we just set up stations for them. We can separate. Not many people will all go to emergency department for survey. And also we have to calculate, like every emergency responsibility hospital, we have to calculate the available ventilator and also the isolation beds. So that's our government to calculate like all of the hospital, the capacity they can use. So once if they have to make sure like he has enough ventilator or the isolation bed for those people. And otherwise, the medical care manpower is important for us to care the patients. So for our government to extend the renewing license deadline, so extend to 6 months later for the healthcare professionals. And also we extend or the 1 year for the renewal deadline for the license for the specialist or the nurse practitioners. And these people, or especially the professionals, they have to provide the disease prevention support, like to help address the issue accounting by people in home quarantine, and the support to the border control at airport. So many nurses, not only in hospital, but also they were assigned to the airport or the community center. Okay, next I will talk about the my experience in my in my hospital. I was briefly introduction about my hospital. It was NCKU. It's a medical center in southern Taiwan, and totally we have like almost 500 staffs, which is including like 800, 900 physicians and 2,000 almost 2,000 nurses, and we have 130 sick beds. So about in ER we have 100 beds and 2 isolation rooms for the suspective COVID patients. So as I mentioned before, those people if is in home isolation or in home in the home isolation, they have to call the local public health bureau or call the Ministry of Health. They have to they cannot go to the hospital by themselves. So if those people needs to go to the hospital, they have to call them, and also these individuals, these symptomatic individuals will be sent to designed medical facility. Okay, so they will buy designed ambulance or taxi for a test or other medical therapies. Not only they was assigned, but also the local public health bureau, they also announce the designed medical facilities. Like we will call like in our hospital, our triage will gather informations before she or he arrives, so they can understand like who the names of the patient and also where his history or the people maybe he contact. So we will know before he or she arrive, and then we can do more prepare for these people. So as you can see, if once the symptomatic patient they came here and they want to, we will ask them to walk into the isolation room from outside. So as you can see, we will ask them to maybe the triage, because our triage is in hospital. So those triage members which is nurses. Our nurses will come outside the hospital and check their vital sign if it is stable. Of course, they will wear PPEs. So they will guide them into the isolation room from outside routes. Okay. So another triage nurse, was take responsibility for the COVID-19 patients or suspect COVID-19 patient. They have to wear the personal protection equipment. So we will go to the isolation room first, and then we will wear the level D personal protection equipment, like the gloves with 3 layers, and we have to wear 2 masks. One is a half mask, and then another one is surgery mask. So after we finish to wear up those things, and then we go inside for the isolation room. So as you can see, the poster is the we have the steps to help the professionals to wear the correct steps. Once they go inside the isolation room, you can see that we have some intubation stuff or some things be there. And actually, once we do imputation, no, and we would we will do the intubation to the patients. So if it's the suspect COVID-19 patients, we will ask at least 3 medical staff. One is the physician, another is a nurse practitioner, and another is the clinic nurse. And one will stay in the front door, and another will be the isolation room stations. So we will we will ask the 5 nurses to prepare and to set up a team. And also we use the radio for communication. That's we have to reduce the members to in and out. Maybe if they have lost something they want to take, or they have to delivery something, the equipment they want, so they can use the radio to communicate. So after the intubation, they have to come out outside the isolation room. So the nurses will come to here for the front door, and we do have to check to take off the gloves or the masks here. So they also have the post to ask to tell or to notice the members that they can wear the steps, they can take off the things. And also they have the mirror to check if it's safety for the professionals. And after that, they can take off the specimen to outside, so they can get a speech or kind of things. The sample, they will put it in the box, and they will lock in the box. So another staff will take the bus into our laboratory. Okay. Of course, we have to put the sample in the 3 bags, which is not reduce the air transmissions. So that's the isolation room station. So we can one nurse will be here to stand by if they have something to want to delivery, or some people they can call help here, so they can communicate with each other. And another things, we have the monitor to monitor the patients inside the isolation room. And we also have the speakers, the broadcast system. So the patients, if the patients can speak, and we can use the speakers to tell us the patient's needs. So maybe we can in the isolation room, we want to reduce the in and out, the times of in and out. So like we want to most of us, we will ask them to use the speaker first. If that's the process, we maybe have to fit their needs. So once the patients have to admissions in the time. So if the patient was is intubations after intubation, and then or he or she cannot walk by themselves, so we will go the inside of hospital process. So our safety guard will make sure that the rooms, the inside hospital process, the rooms is empty. So it's no other people or other patients they will go on this way. So it's make sure it's empty for 30, like at least 30 minutes. So we have to prepare a safety guard will prepare at first to lock the door or the clean the rooms. There's no one can go through it here, and then everything is ready, and we communicate with the ward or the ICU for check. The patient will arrive there as soon as possible. So one physician or one nurses, practitioners or a nurse, and the patients will be sent it or delivery to the first door by medical west elevator, which is designed for the suspect COVID-19 or some the infection, high risk infection patients. They took the special elevator, and after that, until they have finished cleaning all the routes, and then we will just can let everyone can go the route. Another one is if the patient go to admission and needs admission, and he or she can walk by himself or herself, and then we can go outside the hospital process. Like we mentioned before, the patient, if they come to here, they come to ER, and then the patient will stay at they can walk the outside the isolation room. So the patient, after they do the first therapy in emergency, our nurse will take the patients into a designed ambulance, which is in hospital. So the ambulance will go down the downstairs of our hospital parking lot, and then they send it here to send the patient to the basement, level 1, the bio medical west elevator. So you take the elevator, the same the assigned elevator into the ward. So actually in our hospital we have 2 entrances to let the patient and family in and out. So if the patient, they have to come to ER to make the appointment, first of all, the security guard will check the visitors with visit cards. If the visitors don't have visit card, they can't go inside the emergency department. And we have to, the safety guard will assist visitor to write a questionnaire on the website, which I will talk about later. And the first one is the nurses will check their the patient and also their families, the visitors, the TOCC history. And another infrared sensor to check their body temperature. So we will check their body temperature at first time. If they are fever over than 37.5 or 38, we will ask them to go back home to switch another visitors or another family to accompany the patient. So another entrance of the emergency department will we have also used the visit card. They can use the barcode of on the visit card. They can go inside. Otherwise, they cannot go this entrance. So that's our visit cards. One is that here we'll put the and barcode for the patient ID. So after they making appointment in ER, so each patient, they can get 2 visit cards with patient ID. So only 2 people they can go inside. Only we just restrict only 2 visitors go inside with the patient. Another, we have to ask them to write down the questionnaire. So once we just scan the barcode of the patient ID, they can show the patient's ID names here, and we will ask the visitors to write down their information, the personal information, which is the ID or some telephone numbers, names, and we will ask them some questions. I'll talk about later. And once they hear they can the nurse will scan the patient ID. We will know the patient is expiration in the hospital, in the ER, or is the validations. So if the validations, they can go inside, or the expiration, we cannot go inside. So we will know that the patient is in ER or not. So that's the questionnaire, the web questionnaire that we ask the visitors to fill in. So the first one is the certificate. One is the ID card or the residence certificate or passport name, and another is telephone. And also we check the body temperature is normal or abnormal. And also we ask some questions, which is like kind of TOCC history. So the history was entrance or departure in past 14 days, or they are health professional or healthcare workers, and also they have contact with the suspect COVID-19 patients in past 14 days, and also some contact history, and is they also contact the self-health management or quarantine in the past months. So once if the patient answered question 1, question 3, and question 6, they answered yes, maybe we have to ask the visitors to change another family to come here for company or to visit. We'll ask them. We just maybe to tell them feel sorry because we afraid for the infection control. So maybe we can ask you to change another family to come here. And after a safety guard, they have asked them to film they have to check the visit card and also to film the questionnaire. Our nurse will check their TOCC history, which is the T will be the travel history within 14 days. Occupation, like is they have is he or she are the healthcare providers, or they are the transportation industry, and also maybe they have contact history like friends or relative which was travel abroad, or they have some fever or some URI sign, and also they have participated at a public gathering. And the cluster is maybe their family members are current undergoing the isolation or quarantine or the self-management at home. And also they have to contact maybe their family, friends, or colleagues. They have a fever, inspiration symptoms. So we will ask them to sure that the TOCC history is exists or not. And we will ask them to give us the patient them insurance ID. Like we will have to log in the website of Ministry of Health and Welfare. So we use the insurance card to check their TOCC. Like for example, if I check my the insurance card, I will take my insurance card. They can show is I'm in a health care provider or not, or because in last months we have some we have the communal infections in the North Taipei hospital. So the once we log in, we will check if the patients are go the hospital, go to that hospital or not. So we will know if we have to prepare or to ask them to go back home for the self management, or not. Will not allow them to come to the hospital. So, and also we have to scan the barcode to check if the visitors are already filled the data, the questionnaire. So we will scan the barcode to check. So once like we actually are strict to control the infection control before they go into the hospital, go into the ER. So it's very complicated, but it's more strict to check their history, or the contact history. So once they have without the patient or the family without TOCC history, we will give them a stamp to make sure, like not they every time they go to the door, the entrance or the exits, they have to do the double check again and again. So the stamps is only take in the ER, in the front, the entrance of the ER, so everybody knows that he has the TOCC history or not. So if the patients or the family don't have TOCC, the stamps, we will ask them to go outside for check. That's my experience, that how we manage the patient safety in my hospital. So if you have some questions for me, or you want to get more details about how we management the infection control, you can email me. Okay, thank you. So I hope you're well and stay safe and safety. So thank you for your listening.